Labor freshman Dr Ayesha Verrall has been catapulted straight into Cabinet, taking on the role of Minister for Seniors and for Food Safety, as well as Associate Minister of Health and Research, Science and Innovation. The Prime Minister revealed her Cabinet this afternoon. Two of the losers are Jenny Salesa and Phil Twyford, who have been booted from inside Cabinet. Jenny Salesa has lost all her ministerial warrants. Mr Twyford, who was the Minister responsible for KiwiBuild, now holds the portfolio of Disarmament and Arms Control, as well as being the Minister of State for Trade and Export Growth, and he has associate responsibilities for environment and immigration, but all are outside the inner circle of Cabinet. Andrew Little is Health Minister, while Chris Hipkins takes on the new job of Minister for COVID-19 response. Epidemiologist Dr Verrall is a first-term list MP and the only newbie to be brought inside Cabinet. She told me she found out about her new job at the weekend.
The Prime Minister called me and, it was I have to say I was surprised and we talked through the options and how we would make it work.
So, had you expressed interests in these particular portfolios, or what happened before you were told you were in?
No, actually, I had no discussions, had no expectations, but just tried to be prepared for anything that might happen.
So in terms of your portfolios, you're Minister for Seniors and Food Safety. What do you think of your new jobs?
Yeah, so they're really important areas. I think as a doctor in a hospital, I've worked with a lot of seniors at times of difficulty and crisis in their lives, and through that work gotten to know a lot about their circumstances and aspirations, and I want to learn a lot more and deepen that knowledge really through engagement with the sector throughout this term and meeting people in the community. I'm really excited to be implementing our plan for an aged care commissioner, which is really important as well.
So why do you think that is important to have a commissioner?
So it's an important watchdog role, and it also has the ability to make sure that standards of care are met in the sector, and that's really important because some of the people there are in a position of vulnerability in the sector. So it's important to have a watchdog there to make sure standards are kept, and they can also raise issues directly with Parliament as well.
And do you think that this is a particular sector of society that is missing out or being taken advantage of to the point that they need a commissioner?
Well, like I said, I've worked with older people in the hospital, and yes, sometimes I have seen instances where standards weren't met and people suffered as a result. So I think it is an important area.
In terms of your role as Associate Health Minister, what do you think that job will entail? What are your expectations?
Yeah, so all the formal delegations are still being sorted out, but I've been asked to work in the public health area, and one of our key public health commitments in the election was to be smoke-free by 2025, and that's a really ambitious goal and will require a lot of focus to make sure we reach it.
Do you actually think it is achievable?
I think it's really important that we work to achieve it, because there are 5,000 preventable deaths a year due to tobacco, and we have to focus on preventing those.
But is it a reachable goal at this point?
Yeah, I mean there are well-established measures for getting us from where we are to there. The challenge will be building the consensus around them, and that's the work ahead.
So given that's going to be an area of your focus, I'm interested, how did you vote when it came to cannabis legalisation? Yeah, so the issue with, cannabis smoking is harmful, and however, I voted for it because for the referendum, because the harms of people who smoke being criminalised were ones I wanted to avoid. And what about in terms of euthanasia?
I found that a really tough vote, and talked a lot to colleagues in medicine and also to advocates, and decided to vote in favour. So both, two ticks for both of the referendums? Correct, yeah, that's right.
So I want to ask you about COVID, seeing as you are going to be Associate Health Minister. When it comes to COVID-19, do you think elimination remains the best strategy?
Absolutely.
And why do you say that?
Yeah, because you just need to look around the world to see that you can't just have a little bit of COVID. If you let a few cases in, you end up with an outbreak soon enough. And so always pushing towards elimination is the only way to protect us from these large-scale outbreaks.
If we maintain that strategy, again, in your view, does that mean we need to keep the borders closed until we get a vaccine?
Yeah, so I think we're taking briefings on these issues in the next few days, and while I have expertise in this area, I don't want to preempt what officials are going to describe. So if you don't mind, I'm going to listen to those and make sure that in this new role I'm taking all the advice that I can.
In your personal experience, though, with your expertise in this area, do you think that does mean we need to keep the borders closed until we get a vaccine?
So, no, I'm eager to hear what the progress on discussions of bubbles with other countries are and the specific criteria that will be used to determine if they're safe.
So you think potentially we could have travel without a vaccine?
Yeah, I want to see what the advice is, Lisa. That's all I'm saying.
The new Minister for Health is Andrew Little. So have you had an opportunity to sit down and have a chat, a coffee or anything?
We've had a very quick conversation. I'm really looking forward to working with Minister Little and supporting the work he's doing on the Health and Disability System Review implementation. But really, we do need a longer chat.
Are you feeling any nerves or pressure about this? Because you are the only newly elected person to be inside Cabinet. That's a big deal, isn't it?
It is a big deal, and I guess I feel like ever since I was really young, I've taken jobs where there have been big responsibilities. When I was 24, I've been night rostered to work in a hospital with support only on the end of the phone, and so I just need to approach this job with the same diligence and hard work and conscientiousness I have all my others, and I just need to keep my feet firmly planted on the ground and go about it in a conscientious way.
So who are your office buddies? Do you know where you are in terms of who you're going to be sat next to?
Currently my office is my my handbag and my car. So I'm looking forward to sorting that out.
And that was Dr Ayesha Verrall, the newly appointed Minister for Seniors and Associate Minister of Health.